Hi YouTube, this is Ellie. I'm a non-binary trans guy, for lack of a better word, and I am documenting my journey with gender. For the past 3 or so years, I've been taking testosterone, and now I'm at the point where I'm about to get surgery. If this is your first time to the channel, welcome. I hope that the videos help you in some sort of way. And let me just recap a little bit of what's been going on. So, I have recently realized that I definitely need and want to get top surgery. And in order to be able to fund it, I've opened a GoFundMe, which had an amazing response, and I've already been able to put together almost the money that I need to pay for surgery. So I have recently started making appointments with surgeons. This is so crazy. Okay, I've recently started making appointments with surgeons, and I went to the first appointment this week, so I'm going to be talking about it today. So, the first surgeon that I went to see is a clinic here in Barcelona, which is called Tintoré Brasó. Tintoré Brasó. I'm not sure if it's an S or an F. Anyways, this doctor I've gotten a recommendation for from my best friend and semi-relative here, Damien, who might even show up in one of the videos. I've asked him and he's like, yeah, let's do a video together. So you might meet Damien if you're lucky. So Damien had a very groundbreaking surgery 6 years ago. He got lipo instead of getting anything cut. So he basically just had lipo. He still has his original nipple. He still has all of the skin, and he still has full sensation. Which is not a surgery that I want to get because I have a lot of extra skin and I really want the nipple resized and repositioned. But the doctor who did it for him is Dr. Tintoré, and he has a clinic here in Barcelona, and we went to see them. And let me tell you all a little bit about that experience. So, first off, it was really easy to set an appointment. I just called them and they booked me in for next week. They were even like, do you want it to be like in the next 3 days? And I was like, no, a week is fine. The clinic is in a major, it's in a central part of Barcelona, so public transportation was not an issue. I got there by bike. And when me and Damien walked in, he told us, the secretary was like, we were speaking English between the two of us because he comes from the US partially. He's also from Latin America, but also from the US. So between us, we speak like a mix of English and Spanish. So when we walked in, we were just using English at that moment. And the receptionist was like, oh, do you prefer that we speak in English or in Spanish? And that was very nice because not everywhere in Barcelona is going to offer you the possibility of speaking everything in English to you. So, for me, I prefer to have it in Spanish because it also helps me with the terminology, the medical terminology, which is a part of my work. So I was like, Spanish, please. But so everybody and everyone knows that it's a possibility at Tintoré Brasó to use English. Okay, so they were very, very nice. Very nice. And Damien was like, I brought my friend here and I have a surprise for the surgeon. And I was like, oh, you have a surprise for the surgeon? How close are you guys? And when the receptionist realized that he was the guy who had that surgery, she was like, oh, wow. Because it turns out it was the first surgery of its kind performed in that clinic. And that they're if I understand it correctly, the only clinic who does that. Purely lipo surgery for breast reduction. Okay, so we go in to see the doctor, and the moment that almost sold me on this surgeon, if I end up having my surgery done at that clinic, it would be due to that moment, because when the surgeon saw Damien, he literally almost hugged him. It was like, oh, hombre, ¿cómo estás? It was like they were like super familiar with one another, and they were both smiling very genuinely, and it looked like they really had a connection between the two of them. And I was like, okay, I know Damie's really happy with the way his surgery looks, like results. And he says that his surgeon is good, but like kind of to see the interaction between them made me very confident about this doctor being like a good professional and apparently also a good person, or at least they had a good connection between the two of them. And that really means that I can trust him for me, because obviously like Dean is my friend and I trust him. So it's like, you know, it's kind of like it's another level of trust. And then we had the consultation. Dr. Tintoré was like very calm. He was very willing to explain anything that I asked. And it's really great to have a surgeon who is calm, you know. So now I'm going to talk a little bit about the surgery that he proposed for me. So let's take the shirt off, because we're always taking the shirt off in this channel. Okay, so for me, I even wore like a sports bra for you people, so you can see like more like what's going on. So for me, because I have like a skin fold beneath the breast, like I don't have like the smallest breast in the world. I do have a skin fold, and without like support, the breast does like kind of droop. So for me, the lipo option is actually kind of non-option. But I do have like a clearly defined pec line. I don't know if you can see it. Like I do have a clearly defined pec line over here. So that means that whatever the surgeon is going to do is really kind of going to be, here, you can see the pec line. I think you can see the pec line. I don't know. I hope so. So all the surgeons that I've seen so far, the 3 that I've seen in Israel and at Tintoré, they all said that because the pec line is visible, that they're going to be able to easily like place the scar and place the nipple. So he explained that he wants to do like straight scars that round up at the armpit, which I really need to see results for that, because the one thing that I don't want to have is like curved scars. It's like I really prefer just straight scars, or even like diagonal that go like from the axilla downwards. But I am just not okay with like curvy scars, or like scars that go from the middle of the chest downwards. Like, not an option for me. I will not go with a surgeon who does that. So I asked him about that, and he said, oh, the scars don't have to carve if you don't want them to. Like, I can just leave you with a straight line. And it was like not even a discussion. He was just like, that's what you want, that's what I'll do for you, like, no biggie. And that was amazing, because it's almost sometimes kind of hard to broach like even these topics with surgeons, because they can be very particular about what they want to do for you and what they don't, because it's, in a sense, it is their work. It's not just your body, so they can be kind of, I don't know, territorial might be a good word, but like with Dr. Tintoré, I didn't feel that at all. I felt like he was just like, you know, it's your choice, which was great. So the second thing he says he wanted to do, because he usually does, is a lipo for the torso. So what would this mean for me? Because I don't have a lot of fat on me. Like, I have a little bit around like almost my pelvis, like here, a bit of a muffin top, but I don't really have fat on the upper part. So what he said is that he usually does, when he does like top surgery, he does torso masculinization as well. So what does that mean? That means that they lipo from the sides, and I'm not sure if they also do the abdomen, but like, I don't really care about having a six-pack. I just care about having a masculine outline. Like, I would be lying if I said I don't want a six-pack, but it's like not something I would get surgery for, you know what I mean? It's like, that is the line for me between like plastic surgery and gender surgery. So while it would be awesome to have a six-pack, it's not something that I would ask for. So, and I wouldn't pay extra for it, or I wouldn't put myself through more suffering for it, right? But the fact that they do lipo from the sides is really meaningful to me. Usually they do it in order to insert the fat beneath the skin or beneath the muscle in the pec. Now, because I do have some muscle mass in the pec already, it's not a necessity. But since Dr. Tintoré usually does that, he proposed that as an option. And I was kind of like left thinking with like, I actually do have a fair bit of dysphoria about having like these side fat thingies, like, because my pelvis is kind of wide, like, sure, I do have like a nice set of shoulders, and mostly the fat redistribution from my hips is kind of like at its final stages. Like, I don't have a lot of hip fat left. Basically, the only thing besides the width of my pelvis, which you can see, it's not terribly disproportionate to my shoulders, but I do have a little bit of an hourglass because I have like this side fat like this here, which is a very feminine trait. It's a very like estrogen driven fat deposit padron. How do you say padron in English? Pattern. Okay. So as soon as he said that, it's like I got the thought in my mind that if I can have like this little bit of fat mass like removed from the sides, then I would have like a bit more of a V taper. And that thought is kind of like not leaving my head since I've had the consultation, because like, I mean, you say lipo and you kind of think about cosmetic surgery, and it's like, it bothers me that it's a cosmetic procedure that I'm considering to get because it would make me like hotter. But at the same time, when I look at myself and other trans men, I feel like my eyes are directly drawn to this area and kind of directly begin to calculate like, okay, what's the hip to shoulder ratio, and does this look like an hourglass? Because to me, that's like a major source of dysphoria when I look at photos and such, and I'm like, if I can get this as part of top surgery and it doesn't even have like an extra cost, it's just something that they do, ooh, that means a lot. So I am currently like considering Tintoré Brasó very positively, because the price was within my price range. It was 6,200 euros, which I'm almost at the point of having. Like, I'm at the 5,400 mark right now with the GoFundMe. And if I think that I can, with you people's help, like with everybody that's been so cool on the channel, like I think we can do this. I think we can get 6,200 together. I think we can do that. And like the post-op care also was kind of convincing, because they have you come in every day for the first 10 days. Because it's liposuction, they'd like to do a few treatments, which are like lymphatic drainage, ultrasound, and Indiva, which is a kind of heat treatment or light treatment. So as a physical therapist, I am not sold on Indiva. Like, I basically think it is ineffective. However, lymphatic drainage and ultrasounds can reduce swelling and help with the healing process. So it is awesome to know that the post-op care protocol is included in the price. That's very meaningful to me. And then, wow, I've never done a side pose. I think I should. Yeah, that's what I look like from the side. Yeah. Like, that is, wow, I'm so easily distracted. So post-op care is included in the price. I wouldn't have to fly anywhere, which really minimizes the cost of the surgery itself. And it means that I don't have to deal with like flights and luggage when I'm around surgery. And with the whole COVID shit, it's like, it's a lot easier to like plan things when I know that I'm not dependent on a flight that could be canceled. So that's important. So they're here in Barcelona. I have a lot of confidence in Dee, and his relationship with the doctor seemed like very like humane and respectful, which is awesome. You want that in a surgeon. The one thing I am missing in order to be able to say, yes, I want the surgeon, or no, thank you, is to see results. So I have an appointment like with them basically in the coming week. They're supposed to call me and say, hey, come in to see a few pictures of results, because none of that was available online anywhere. And and once I have some results, I'll be able to say like yes or no. It basically depends on like how good does the nipple look after repositioning, and how much smaller can he make it, and about the scars, like the rounding up. They say it's supposed to follow your pec line, but I really need to see that in order to decide if it's okay for me and if it doesn't look too much like a breast, because I understand some people have rounded scars and they're perfectly okay with them, and I'm happy for them that it works for them, but for me, it's, I couldn't do that. So that's the way it is with Tintoré Brasó right now. I'm kind of leaning towards getting it done there, because I've heard like not amazing things about the other surgeons in Barcelona. But I'm probably gonna do like an interview with Dr. Musolas, who's also here, who's the most experienced one. And there was another doctor that I needed to go see that I can't remember. Never mind, I'll do videos about that as well. So I'm kind of leaning hard towards Dr. Tintoré right now, but that could also be like it's like trying on the first pair of shoes. It's like, no, it doesn't matter how good you feel about that. You still need to go on and sort of see the other options before you decide. Okay, so I'm going to bring the cat in just to say hi. Chappy! She was sleeping and I woke her up. So we're just bringing her in so she could say hello. Chappy! Meh. She's in a cuddly mood. Chappy, say hi to the internet. Hi, internet. Okay, done cuddling. Alright, everybody. Have a great day. Any questions that you might have, just shoot them my way. And yeah, let's do this. Okay, if you want to help with the GoFundMe, link in the description, please donate, and thank you very much.